Good afternoon, everyone. We're just going to give it another minute or so for people to log in this afternoon. We hope everyone's doing well. Oh, there's Shelley.
Cheating today. Yeah. Health council stuff. I'm just gonna let it run. Let's see what happens.
Yeah.
Oh, we're
And
gonna be on.
And as you join, if you wouldn't mind putting your name and who you're with in chat, that's always very helpful to us, knowing who's here. And just a reminder, if you're not speaking, if you wouldn't mind putting your microphone on mute, that's helpful to block out any background noise. And while we're waiting to get started, I will go ahead and bring up. Here, wait, let me get out of here. It didn't go where I wanted it to go. Okay. There we go. All right, well, we'll go ahead and get started. I'm going to share my screen and just introduce today's topic, which today we have Teresa Bellinger along with Orlando Vasquez and Shelley Begay will be talking about Turquoise Care and the New Mexico Medicaid Managed Care Program. And before we get started, I do want to make sure that we give our land acknowledgement. And I'll start off by saying New Mexico Alliance of Health Councils humbly recognizes and acknowledges that we are on unceded territory and ancestral lands of the original peoples of New Mexico's Pueblos, Apache Nations, and the Navajo Nation. Together, we acknowledge the history of genocide, dispossession, colonialization, and ongoing systemic inequities while strengthening and respecting relationships with Indigenous peoples. We give thanks to the past, present, and future stewards of the land and respect all tribal nations' sovereignty. In offering this land acknowledgement, we affirm Indigenous resiliency, self-determination, and self-governance of New Mexico's tribes, pueblos, and nations who are still here today. And we just have a couple announcements before we get started. So Sam, I'm going to hand it over to you.
Thank you. So Geraldine just asked that we remind everybody about the County and Tribal Health Council Equity Survey that we sent out a little bit ago. The Equity Committee is comprised of NMHC staff and board members and health council members. And we're just in the early stages of formation and kind of want to get a grasp of where your health council is at, what initiatives you have going on, and how we can better serve, that. I just lost my word. I'm so sorry. Equity-based trainings and educational opportunities. So I'll just kind of drop the link to it throughout this presentation in the chat, and then you can also look for it in your emails as well.
Thank you, Sam. All right, so I'll hand it over to you, Teresa, for today's topic, and you can take it from there. And just let me know when you're ready for me to bring up the slides.
Okay. And could you project the slides, please?
Sure. I sure will.
Thank you. I want to thank you, Susan, for your introduction, as well as the New Mexico Alliance of Health Councils for having us today. We always appreciate partnering with other entities to talk about Medicaid. We have a lot of changes coming up, so I'll be talking about those today. Medicaid, as well as our healthcare authority. And I just want to let you know, my name is Teresa Bellinger, Native American Liaison with New Mexico Medicaid. I'm an enrolled tribal member of the Sault Ste. Marie Tribe of Chippewa from the Upper Peninsula of Michigan. And we also have Orlando Vasquez, who works with me from the Education and Education Bureau, Communication Bureau. And my supervisor, Shelley Begay, was also able to join us today.
Yeah, and I apologize, for some reason my computer just all of a sudden started giving me issues. So let me see if I can.
Okay.
Oh,
Well, there we go.
thank you, Sam.
Oh, and I also wanted to just let you know, I think the group is small enough that we could entertain questions or comments throughout. If you have questions, let us know, because we don't want to, I don't want to have you wait to the very end to ask your question. You may forget it by then or whatever. So you're welcome to ask questions as we go along, okay? Okay, next slide. So this is what we'll be talking about today. We did our introductions. We'll be talking about Turquoise Care, the new name for New Mexico Medicaid. Orlando Vasquez will be going over the 4 managed care organizations that will be part of Turquoise Care. We'll be talking about open enrollment questions and answers. And also the Human Services Department is also going through a name change, becoming the Healthcare Authority. Hopefully you are aware of that. That has been going out in emails from the state. And then question and answers if you have any other questions toward the end, okay? Next slide, please. We also, before we start, have a land acknowledgement through the Human Services Department. And thank you, Susan, for providing that. I thought it was a beautiful land acknowledgement. So we can skip this slide since you've already done that very well. So the mission of our healthcare authority is to ensure that all New Mexicans have the highest level of health by providing cost-effective, accessible, whole person, high-quality health care. Our vision is that every New Mexican has access to affordable healthcare coverage through a coordinated and seamless healthcare system. And that could be either through Turquoise Care or through our Be Well New Mexico. We aren't going to be discussing Be Well New Mexico, but that is an excellent resource for people who are over income for Medicaid. Our goals are to leverage purchasing power and partnerships to create innovative policies and models of comprehensive healthcare coverage. Build the best team in state government by supporting employees' continuous growth and wellness. Achieve health equity by addressing poverty, discrimination, and lack of resources, building a new Mexico where everyone thrives. And implement innovative technology and data-driven decision-making to provide convenient access to services and information. Next slide, please. So we're going to start by talking about Turquoise Care. Here's some upcoming changes that have already started in some places. But starting July 1st, 2024, Western Sky Community Care will no longer be a Medicaid managed care provider.
Hmm.
Starting July 1st, 2024, we will have 4 MCOs. 2 MCOs are from our previous Centennial Care, and then 2 new ones will be joining us. And they are the ones we've had, our incumbents are Blue Cross Blue Shield and Presbyterian. And our 2 new managed care organizations will be Molina Healthcare and United Healthcare. We're currently on open enrollment, and so individuals have been given yellow envelopes to select the MCO that they want, and that open enrollment began April 1st, 2024, and that runs through May 31st, 2024. Next slide. So what is a managed care organization? And you'll hear me call it MCO. It's a health plan that addresses the physical health, behavioral health, and long-term needs of its members. Why does Medicaid use a managed care model? Because managed care is designed to improve health plan performance, healthcare quality, and outcome for its members. What is the relationship between the MCO and Medicaid? The MCOs contract with providers, healthcare providers, behavioral health providers, long-term care providers, and healthcare facilities to provide services to our Medicaid members. Next slide, please. There are some exceptions to the mandatory enrollment in managed care. Currently, individuals that are in managed care organization, except for Native Americans and the list I'm going to talk about below, need to select an MCO and be part of of their Medicaid program. However, there are some exceptions. Native Americans are not required to be in managed care unless they're receiving long-term care services. If they're receiving long-term care services, that is only offered through an MCO model. It is not offered through the fee-for-service system. And then individuals in intermediate care facility for individuals with intellectual disabilities are not mandated to be in an MCO. Our population that are in the Medicare Savings Plan, such as qualified Medicare beneficiaries, QMB, specified low-income Medicare beneficiaries, otherwise known as SLIM-B, or QI, qualified individuals, they're not required to be in a managed care. Individuals that are covered under family planning are not required to be in an MCO. And then individuals that are in the all-inclusive care for the elderly, the program for all-inclusive care for the elderly, the PACE program, are not required to be in an MCO. And finally, those that are under emergency medical services for non-citizens are also not required to select an MCO. I'm going to just take a pause there. Is there any questions or comments at this point? And I may not be able to see all the comments or questions, so Susan, if you can help me make sure I recognize people.
I sure will.
Okay, so we've been at this Turquoise care process for several months. In November, we signed contracts. New Mexico Medicaid signed contracts with the 4 Turquoise Care MCOs: Presbyterian Health Plan, Molina Healthcare, Blue Cross Blue Shield, and United Healthcare. And then we began to work together in December to make sure that our MCOs were prepared and ready to provide services in New Mexico. We worked on reviewing any member materials that have gone out. We've been making sure they're following contract requirements, that they're familiar with our programs, especially our Native American population, that they have teams, Native American liaisons within their MCOs to work with our tribal populations and Indian health service providers. We've been working on that through April, and then April 1st, yellow envelopes have gone out for many of our Medicaid members for open enrollment. And as a reminder, that ends May 31st. In June, we will, the MCOs will be sending out member notices, member handbooks, and ID cards based on those decisions that were made to select the MCO. And then Turquoise Care begins July 1st, 2024. Next slide, thank you. We have some Turquoise Care goals as well. That every New Mexico Medicaid member has high quality, well-integrated, person-centered care to achieve their personally defined health and wellness goals. Goal number 1, we want to build a New Mexico healthcare delivery system where every Medicaid member has a dedicated health team, accessible for both preventative and emergency care, that supports the physical, behavioral, and social drivers of health. We want to strengthen the current New Mexico healthcare delivery system through the expansion and implementation of innovative payment reforms and value-based initiatives. And I'll be going into that a little bit more down in a few slides. Our third goal is to identify groups that have been historically and intentionally disenfranchised and address their healthcare disparities through strategic changes so that they have a chance at living healthy lives. And of course, one of those populations is our Native American population. I'm excited to talk about some new benefits that are coming under Medicaid. The first one is continuous eligibility for children up to the age of 6. And that started January 1st, 2024. How that works is that for families that have children under the age of 6 that are on New Mexico Medicaid, they, once they're approved and they remain eligible, the parents won't have to re-enroll them every year for Medicaid. It's an automatic enrollment up to the age of 6. We're also expanding access to supportive housing throughout the state. We're adding chiropractic services to our benefits under Medicaid. We're also adding additional community benefit slots. For those of you, hopefully you are familiar with that program, but that's a program that keeps our disabled and elderly in their home as long as possible with some support so that they don't have to go to a long-term care facility. And I know that's a very popular benefit. Of course, people are happier in their home if they can live there independently with some assistance. And then an expansion of the home visiting program for new moms. Okay, next slide. Here are several behavioral health services that we are expanding under Medicaid. And I won't be going into detail. If you want information about these programs, please reach out to myself or Orlando or Shelley Begay, and we will get you in touch with our Behavioral Health Services Division to go into detail. but we're adding, oops, 1 second. Yeah, we're offering dialectical behavior therapy, eye movement desensitization and reprocessing therapy, mobile crisis intervention services, trauma-focused cognitive behavioral therapy, and then functional family therapy under our behavioral health services repertoire. Okay, next slide. We're going to talk for a minute how Turquoise Care works for children that are in state custody. Generally, children that are in state custody will be under Presbyterian health care. They have been selected as the MCO to serve this complex and vulnerable group of children. So they may currently be in one of the other MCOs, but they will be part of Presbyterian healthcare under Turquoise Care. They have a dedicated team of staff, of care coordinators at Presbyterian to help to work with children in state custody as well as CYFD. And they will be providing services designed to improve the health outcomes and experience of children and their families and caregivers. There is an exception to that. Native American children that are in state custody will continue to either be on fee-for-service Medicaid, or they can be in any managed care organization. So they're the one exception for children in state custody. Again, their guardian, their parent will decide whether they will remain on fee-for-service Medicaid or be in one of the managed care organizations under Turquoise Care. Do we have any questions about that?
Hi, Teresa. I don't have a question about the children in state custody, but going back to the previous slides about the new services, and I'm curious about it. It's not a new service, but I know in July of 2023, Medicaid changed their rules around Medicaid reimbursement for community health workers and community health representatives. And so with the new MCOs coming on July 1st, in the past, that care coordination piece, which community health workers can provide within their scope, certain elements are within their scope. Are MCOs, do you know if the community health workers will actually be local in communities? Are the MCOs required to contract locally, or are they centralizing that, keeping that service centralized like they have in the past specifically with the care coordination?
I am going to defer to Orlando and Shelley if they want to weigh in on that, and then I'll make a comment. Orlando, do you or Shelley want to comment on that?
I'll refer to Shelley. I'm not sure what the answer would be to that.
Hi, this is Shelley Began. I'm familiar with some of the recent changes, and I apologize. Okay, my camera's not working, but I think we need to get some policy clarification. I do know that some of our managed care organizations do extend supportive staff that represent the community that they come from. This could include, peer support staff, community health workers, additional behavioral health staff. But as far as policy clarification on the requirements to extend, we'll get some clarification on that and submit that to you, Susan. But I think there's some good news regarding our CHWs and CHRs, and I think that's what Teresa is going to mention next. So I will work on that right now and see if I can get an answer before the end of our meeting.
Wonderful. Thanks, Shelley.
Yeah, so we've been really involved in that as well under the Medicaid office, because Shelley and I work a lot with the tribal community health representatives who do a great deal of work, just like your CHWs out in the communities. As far as our community health representatives, they do not have to contract for services, but they can. Their tribe can contract for those services. Also, they're allowed to bill up to 10 hours a month on an individual. That'll be at the fee schedule rate. It's so there is and there's 4 different codes that will be used when billing occurs. So as far as care coordination, there may be some limited care coordination going on. But as far as the main care coordination would be through the MCO, and then they will pull in the CHRs and CHWs for more support in the community. But we will get you additional information on that. And once we get this, the codes and everything set up, we will be offering a training on that too, how to bill for those services, because I know that people are going to want that. Okay. All right, Turquoise Care open enrollment. As I mentioned previously, Turquoise Care starts July 1st, 2024. And individuals will have the choice between Presbyterian Healthcare, Molina Healthcare, Blue Cross Blue Shield of New Mexico, and United Healthcare. And as you can see, Western Sky will no longer be in that group as of July 1st, 2024. So we are currently under open enrollment. We've sent out yellow envelopes. We've asked that people carefully decide which managed care organization. Some will stay with Presbyterian or Blue Cross Blue Shield. They may not want to change. And if that's the case, then they don't have to do anything. They will remain a member. Or they can select Blue Cross Blue Shield or Presbyterian on their membership card. If they're in Western Sky Community Care and they don't select an MCO, one will be auto-assigned to them because Western Sky is not contracted into Turquoise Care. The MCO that they select will be for a 12-month period. And each year, members can change their MCO just like the way it is now. So if they make their selection by May 31st, it'll be effective July 1st, 2024 for their Turquoise Care MCO. Next slide. Native Americans who are eligible for Medicaid have the choice, again, to enroll in Turquoise Care by opting into managed care. If they don't want to be in managed care, they can remain in fee-for-service. Native Americans are not required to enroll in an MCO unless they receive long-term care services. As I mentioned earlier, this group, these programs for long-term care services are not offered through fee-for-service Medicaid. They're only offered through an MCO. And then Native Americans enrolled in managed care can still access services in Indian health service or tribal health programs or urban Indian programs. Some people have the misunderstanding that once a Native American enrolls in an MCO, they go to the MCO's providers and they don't go to IHS. They don't go to their tribal 638 healthcare facilities. That is not the case. They can still go, even if they're in an MCO, to the Indian Health Service or Tribal 638 or Urban Indian Health Program. Next slide, please. This slide refers back to when we were speaking a minute ago about children in state custody. And the acronym for that is CISC. Children in state custody, as you can see on the enrollment as of March 26, 2024, there was a total of 2,093 children in state custody. There's a breakdown of what MCOs they were under, Presbyterian having the most, Blue Cross Blue Shield, and then Western Skies. And then we have a breakdown of the number of Native American children that were on fee-for-service. Back in March, at that time, there were 50 children on fee-for-service, Native American children on fee-for-service, but many were in Presbyterian, Blue Cross, or Western Sky. Okay, next slide. So how does the state monitor managed care organizations? I'm glad you asked that. Medicaid monitors MCOs through many reporting elements, such as provider network adequacy, service utilization, special populations, such as children in state custody, long-term care members, and high-risk pregnancies. I actually am responsible for several reports that I complete quarterly that the MCOs submit data and that I have to evaluate on. So that is one of the ways we do a lot of data analytics. We do a lot of research in those areas. Who's utilizing the services and who isn't? Are they getting their provider needs met? Is transportation an issue? We keep an eye on all those things. Are they able to get the care when they need it? So Medicaid monitors the MCO's compliance with contract requirements, the policy manual, and our state code. And as I said earlier, Medicaid also monitors quality metrics by the MCO network performance. They have to follow HEDIS measures. We keep track of that. We have a quality bureau here at Medicaid that watches that carefully. So we have a lot of people behind the scenes monitoring the work that the MCOs do. Next slide. When we go out throughout the state presenting on Turquoise Care, and people, and human nature being what it is, when they will ask a relative, what MCO should I choose? Or they may ask the individual that's working with them at the Income Support Division office. Or they may ask their doctor, which MCO should I choose? We suggest that individuals speak to their hospital or doctor. If they want to stay with that doctor and they like him or her, ask them who they contract with. That way you'll be sure to keep the provider that you currently have. Another thing you could do is ask them, if you're on certain medications, ask them about their formulary. Do they cover the medications that you're on that you need to take? Another area is value-added services that the MCOs provide. This is above and beyond the basic Medicaid package. All 4 MCOs offer a basic Medicaid package, including fee-for-service. We all offer a basic. But value-added services is something the MCOs offer above and beyond at their expense, these services. And that's another good way to determine which MCO is the best fit. Orlando will be going over some of those value-added services with you But we also have a comparison grid. Have you received that by chance? An MCO comparison grid? That's another good way at a glance to look at what each MCO is offering under, maybe under pregnancy services, under childhood services, under behavioral health, under services for the elderly. And it's a side-by-side comparison between each of the MCOs. So we'll make sure to get you that. That's a very handy tool. Next slide, please. So as I said earlier, people are in the process of, we're in open enrollment, and people are in the process of selecting their Turquoise Care managed care. How can they make their choice? There's several ways to do that. They could go through our website at yes.state.nm.us. They could call our 1-800 number and make their selection that way. Or they can complete the enrollment form that they were sent and make their decision that way. If you know of individuals who have not received their yellow envelope and need to make the selection, please let them know that they do have the option of going through our website or through the call center to make those selections. Now, like I said earlier, if they're on Blue Cross, Blue Shield, or Presbyterian and don't want to change, they'll just remain in that same MCO. Any questions about that?
Once again, Teresa, I don't have a question, but health councils often serve as like a communications health hub for many of our communities and both county and tribal communities throughout New Mexico. Is there information, any way that they can help you get some of this information out into their communities? I know the deadline is just coming up in a couple of weeks, but just a thought if there's anything, any way that they can support you in making sure this information gets out.
We're going to come to a slide that has all of our different websites that they can look at. I think it would be, you have a copy of this PowerPoint, and educate yourselves so that you know what questions to ask people to make sure, if you received your envelope, did you complete your selection? If you didn't receive an envelope, how do you make your selection? So check in with people and make sure that they understand the process. But we do have a slide coming up, Susan, that gives some additional resources. We also have frequently asked questions. You might want to read through that. That provides some great information. You're welcome to copy it and hand it out to people so that it covers maybe certain questions that they may have.
Great,
So let's go to the next slide. This is a picture of the yellow envelope I've been referring to. Next slide. Here's the website. If your workers want to go, your health councils want to go to our website, they can get a wealth of information on Turquoise Care. There is a link there for Turquoise Care. And if you go to the next slide, I believe, that's the frequently asked questions. And we have frequently asked questions for Medicaid members, for Native American members, and Orlando, what was the other group? Was it the
I think there's some long-term or nursing facility questions in there.
Great.
Native American
providers? Yeah.
Providers.
Yeah. Great.
Yeah, they're grouped by the topic. At least they're grouped by the topic.
Sorry about that. I should have seen that. Next slide. Do the MCOs provide different services? The medical, behavioral health, and long-term services and support services for members are the same across all MCOs. And like I said earlier, each MCO offers a unique package of value-added services that differentiates one MCO from another. And these value-added services are extra services outside of Medicaid that seeks to improve quality and health outcomes, reduce costs by reducing the need for more expensive care. Okay, next slide. Okay. I know we have a slide of all the links that you can download for information. We'll get to that. Since we don't have our managed care organizations here today, Orlando Vasquez has been kind enough to go ahead and go over the MCO presentations. Orlando?
Thanks, Teresa. So again, here's the list of the 4 MCOs that we're going to be working with for Turquoise Care: Blue Cross Blue Shield, Molina Healthcare, Presbyterian Health Plan, and United Healthcare. Again, these all start on July 1. And as Teresa also mentioned, they provide value-added services, which are in addition to the required services. So I'm going to briefly go over there. Each one probably has a dozen or so value-added services. Some are similar and many are different. So let's go ahead and go to the next slide. And I believe the first one is Blue Cross Blue Shield. I think there's a couple slides up, so I'll just touch on some of the more prevalent ones, I guess, if you will. Those after school youth activities, they'll cover covers the fees for some of those school activities with Blue Cross Blue Shield for the members enrolled. They're in school, I should say, and they want to enroll in some of the sports activities at their school. And there's a cost to that. Blue Cross Blue Shield would help with that cost. The infant diapers for new mothers or recently having birthed a child. They're available to pregnant members and new moms for the first month of the birth of the child. The Native American Traditional Healing Benefit grant available to Native American members for traditional healing practices for the treatment of diagnosed conditions. So again, and then we go on again to the next slide. Here's some more. The respite bed provides a temporary bed for members discharging from an emergency room or hospital who are medically vulnerable. The electroconvulsive therapy, caregiver thank you packages that provides family caregivers a gift package and educational materials. And then the toolkits, I don't know, I guess that's one whole line. It looks at the very bottom for justice involved members and members experience homelessness. A toolkit includes resource information. I guess that's the last of that one there. So again, these are things that would need to be the member wanting to take advantage of any one of these value-added services would need to work with their care coordinator at the MCO. And that goes for all 4 MCOs actually. Next slide. So now we move on to Molina. Molina value-added services. They have in this first block here all these different services that they're offering: vision, dental, housing, transportation, all these things here. The services that are available through Molina equal a total of $4,100. And those monies would be available through a prepaid debit card. But again, the member would need to work with their Molina care coordinator to determine what and how much service they need in relation to what's listed here. And then that debit card would be loaded with that much money. And the member would go to a vendor to have that service provided. They would have to have that specific amount only and go to a specific provider that's been agreed upon with Molina in this case. And then they have up to $500 a year for new baby items, for car seats, cribs, strollers, that kind of stuff. Again, they would need to work with their care coordinator to request this kind of services. Fresh produce and healthy food at no cost based on the need and health. And again, these are available to all anyone that we're going to be talking about here. These the last few and the next upcoming slides are available to anyone within the MCO. Again, they would work with their care coordinator to access that service. And then there's always some limitations, and that approval needs to happen too, again, with all the MCOs for any of the services. Next slide.
I'm just gonna let Susan take over the slides real quick, so just 1 second.
Okay. Well, and then continuing with Molina value-added services, they offer up to $550 a year for holistic and traditional healing, like traditional ceremonies and services. Can't say that word. You can read it. Acupuncture, therapeutic massage, and herbal remedies. And then the last one here, the Molina Help Finder. They're out online search tool to find basic and necessary community assistance and resources such as food, housing, transportation, and that's again accessible through their My Molina member portal and mobile app. Next slide. Moving on to Presbyterian value-added services. Next slide. Ooh, that's kind of small to read. They have a long list. I'm going to just touch again on a few. The Pregnancy Passport for a New Parent program is a program that offers rewards for attending prenatal and postpartum appointments. They want to help the mother and enjoy and understand their pregnancy. They can earn gift card incentives, my apologies, just for going to their prenatal and postnatal doctor visits. So it's an incentive for them to take advantage of these services while they're pregnant and postpartum also. The enhanced care coordination specialized services, the middle of the page there. Additional services for members in care coordination. These services include wellness programs, home monitoring for high-risk members, and individualized services for members who meet criteria and a part of the member's care plan. So again, how I was saying earlier, they would need to identify the need and qualify for these value-added services. The wellness classes at the bottom, statewide community and online wellness classes for members with diabetes and/or asthma. They offer a gift card incentive to members to participate in and complete a class. Next slide. Moving on to United Healthcare. Next slide. Their health-related social needs, they have this little list here. Medically tailored meals for members experiencing certain transition of care. One pass fitness program to a local gym, over 20,000 virtual classes. They enhance diet and virtual counseling with any network provider, regardless of the diagnosis. Transportation, which is a fairly big issue. Transportation services for non-medical community services, such as women and infant and children, birthing classes, places of worship, grocery stores, job-related activities, food pantries, and support group meetings. So these are things that a member with United Healthcare, if they had a need for transportation, they would present that need to their care coordinator at United Healthcare, and they would determine if, when, how much of transportation service could be made available to an individual, again, with United Healthcare. Moving on to maternity supports, baby scripts, a digital maternity education, engagement, and incentive program for members who are pregnant and new parents. The WellHop, virtual support group alongside members at the same stage of pregnancy. So what this one is going to do is for women that are around the same stage of pregnancy, they're going to get them together and learn from each other, bounce ideas and issues and whatnot off of each other, just to help to support each other during their pregnancy. Social determinants of health, the Workforce Fund, scholarships and funding to members seeking to obtain certificate degree or workforce programs, And then the last one there, emergency clothing allowance for school-aged children. So that's good at the beginning of a school year, trying to get them their uniforms or just new school clothes, whatever that might be. Children and adolescent health. On My Way is an online support program for all children and youth who are transitioning out of the justice system or transitioning to independent living. Pillow and mattress cover for children with asthma or allergies. Moving on to senior and elder healthcare. The self-care is a self-help digital application that uses tools, techniques to improve overall mental well-being, education, support, and empowerment for unpaid and family caregivers, including from underserved communities. The Pearls, they like this program a lot. Wherever United Healthcare does. Program to encourage active rewarding live support offers in-home peer counseling designed to reduce symptoms of depression and improve quality of life. And then the senior one, it's a concierge assistance for members seeking care at skilled nursing or home care facilities. Behavioral health programming, online behavioral health resources connect members to information and resources for overall health and wellness, including special behavioral health tools, resources, and information. And then at the bottom here, the traditional healing, alternative healing, traditional healer ceremonies, ceremonial items and supplies, supports member preference for alternative healing, and provides resources to promote cultural being. I think that's it. You want to go? Yeah. So those previous 8 or so slides are something to help each member in their decision in picking an MCO. Although the most important thing is that their primary care provider, the provider they see the most, is contracted with the MCO that they're wanting to choose or be enrolled with. That's the first thing that they should really be concerned with. And then these value-added services, which one are they interested in? That would be most helpful to them.
And Susan, thank you so much, Orlando. If you could just, Susan, could you go to the slide about, if you can, about the Healthcare Authority? I know it looks like it's the end, it's almost the end, but yeah. Okay, keep going, please. Next slide. Next slide. I think we can go on the next slide. Okay, so I just want to talk real quick about the Healthcare Authority because the Human Services Department is changing its name to the Healthcare Authority, and it's launching July 1st, 2024. That the new Healthcare Authority will include the current programs from Human Services Department, which are Income Support Division, Behavioral Health Services Division, Child Support Services Division, and Medical Assistance Division. Those are not changing. There's just a new name, and it'll be called the Healthcare Authority. And under that umbrella of the Healthcare Authority will also be the Developmental Disability Supports Division and the Division of Health Improvement from DOH. They will be also under the umbrella of the Healthcare Authority, as well as the Employee Benefits Bureau from General Services Division and the Healthcare Affordability Fund from Office of Superintendent of Insurance. So as you can see, there's like 7 more divisions or departments, departments under the Healthcare Authority that will launch on July 1st, 2024. Again, if you want more information about this, you can go to our website and get it. If you could go to the next slide, Susan. Yeah, so this slide just goes over what's changing, what's staying the same. Basically, you know, we're changing our name, but the services will remain the same. Okay, I think we're at time. We want to thank you very much for the New Mexico Alliance of Health Councils having us today. There is the links, that last page were the links to information about Turquoise Care. If you want to download that information, there's great information, great resources there. Do I have any questions or comments from anyone? And I know Shelley's been posting things to the chat as we've been talking.
Yes, and thank you, Shelley, for doing that. Any questions? And of course, for the health councils, as you know, we always send out a link to the recording, and you'll be able to access the slides and reference all of those other links for information if you need those, and if you could help HSD, soon to be the New Mexico Health Authority, get that information out, that would be awesome. And then any questions or comments?
Hi, Susan. Thank you all again for having us on. I did send over the information for our virtual town hall on May 22nd. I just want to make sure that individuals have access to that. It's going to be, of course, a Zoom link that is going to be sent out. Individuals do not have to register. You can go to our social media website at the Healthcare Authority. Human Services Department is probably still the name. And our Facebook website will have more information, but I did put that direct sign in and telephone number in an email and sent it to you all. So I appreciate it if you all share it.
Right, and Sam Hemming, our communications and marketing person at the Alliance, she will be sending that out in our newsletter. So you'll also have that. It'll probably be on Monday where you'll get that information.
Thank you.
So thanks, Shelley, for that reminder about that important town hall meeting on the 22nd. And last but not least, I don't see that Debbie joined us, but Debbie Ortiz, she's the board chair of the New Mexico Alliance of Health Councils, and she just wanted to remind health councils that you will be receiving a link. There will be 2 presentations about your FY25 scope of work and contract and what the process is. So if you should have received an email from your health promotion teams this week within the last couple days. You will be getting a link to join a virtual session about your contracts, and please plan to attend. This is your opportunity to speak up and ask questions as you review your scope of work, and we'll have the health promotion team there from Department of Health to answer any of your questions. Right, with that, well, we want to thank you so much. Thank you, Teresa, Shelley, Orlando, and great news, good work. We look forward to the new Turquoise care system, and anything that we can do to support that, let us know.
Thank you.
Okay, thank you, everyone. Happy Friday.